Hello, today we're going to do a central venous line access device. We're going to do a dressing change. First thing we'll do is review and verify the physician's order. We're going to identify the type of vascular access device dressing change and the supplies needed. I need a central line dressing change tray with ChloraPrep as well as a sterile bio patch. I have it in a sterile packaging so I can show you how you would put it into the package. You also need regular exam gloves. And then I'm going to go ahead and go into my patient room and identify my patient with two identifiers. And I am going to apply a mask on my patient, ask them to turn their head away from the central line, and I will also have a mask on myself. I'm going to go ahead and wash my hands when I enter the room and put on my regular exam gloves. And I am going to go ahead and start removing the dressing. And I want to remove this so that it's going towards the insertion site. You can use counter traction to prevent the skin from coming up. Most of these access devices will be secured with some sutures so you don't have to worry about them coming out, but if you want to secure it, that's fine. All right, now I'm going to assess my insertion site. I'm going to be looking for signs and symptoms of infection such as redness, swelling, drainage, or any kind of odor coming from that. This site looks really good. Next, I'm going to open up my sterile packaging for the dressing kit. I'm going to open that up. They have a mask in there to put on the patient or yourself, but we've already put that on because the site is already open, so we want to make sure that those gloves are on, or the mask is on before that. I have my sterile gloves. I also have this bio patch. This is an impregnated disc that we want to put right there over the insertion site. Some facilities will have those in the kit, others will have them in sterile packaging, and so I just have this in folded up paper, and I'll show you how you can put it into the sterile package. You basically just open this up without contaminating. You have that 1-inch border, and then you're going to kind of flip it over in there and just get it into the package without cross-contaminating. All right, I will put on my sterile gloves. These gloves stick together, so they're really kind of a pain. Step back. All right. Okay. Now I'm going to take my sterile drape, open it up. If you have a patient that is laying in the bed, this is a lot easier to use. On this, it's not so easy, it doesn't stay. So you would just pretend to put that on their chest. Then I'm going to get the ChloraPrep, crack it open, and then when you are cleaning this, you're going to clean it starting at the insertion site because this again is a very open area, wide open. So we want to make sure that we clean that first using sterile technique, and you don't want to go over that insertion site more than once. So you're going to start right at the center and you're going to kind of do a half moon shape, and then you're going to start going out and around. 30-second vigorous cleaning to the area in which the tegaderm would cover. Don't go over the insertion site again once you clean it the first time. Do this for 30 seconds. And then you're gonna end it by going down each pigtail one time each. And then the next thing you're gonna do is get that impregnated disc out. You do not want to touch the center of the disc because that's going right over that insertion site. So you're going to kind of just lay it over there like that. Don't mess with it. Once you get it on there, leave it alone. You're gonna allow your skin to dry, or that ChloroPrep to dry. And then you're going to center the Tegaderm over the insertion site and the anchor there, making sure that that's in the center. Well, having a little bit of technical difficulty. Because I didn't let it dry. And then you're gonna label your dressing. You're gonna put your name or the initials and your date on here. And then make sure that you put that on the dressing. And that concludes a central venous access device dressing change.